let's start with Crohn's disease. Common symptoms: abdominal pain, diarrhea are the common symptoms. But you can have very different kinds of symptoms depending on the location and the impact of that inflammation. Um, uh, you can have nutrient deficiencies, and then you can have symptoms because of that. But in general, when you get patient presenting to you for the first time, what you notice that they are either complaining of abdominal pain. In young kids, it's failure to grow, weight loss is very common. Fevers, they are having fevers and nobody could figure out why they're having fevers. And then when they do more workup, they find out and discover that this was Crohn's disease causing these fevers. But typically it's the abdominal pain and diarrhea that is major symptom of Crohn's disease. So many patients with Crohn's disease and ulcerative colitis present with what we call extra intestinal manifestations. So they have these manifestations that involve more than just gut. Most common being skin and joints and bones. So a lot of patients who have IBD, Crohn's disease or ulcerative colitis, have joint pains also. And many times we have observed that joint pain could be their first symptom. And they are going to a rheumatologist first or a joint doctor and getting diagnosed with either an autoimmune joint problem, or the rheumatologist is saying that, you know what, you are also describing these vague abdominal symptoms, so let's get you ruled out for Crohn's disease and ulcerative colitis. Sometimes we see patients coming from dermatologists. Because now you're having skin problems that sometimes can be associated with Crohn's disease and ulcerative colitis. You can have eye problems, uveitis, episcleritis, so inflammation of your eyeball that can be associated with Crohn's disease and ulcerative colitis. So two important things to remember. Number one, that the inflammation can happen anywhere in the body in Crohn's disease in your intestinal tract. So you can get mouth ulcers, you can get inflammation in your food pipe, you can get ulcers in your small intestine, and depending on where the inflammation is, swelling is, you will get symptoms accordingly. For example, if the ulcers are in your mouth, you won't be able to swallow and talk, and that can lead to infections in your oral cavity, gum swelling, and then it will not help you get the nutrition, and then you can get malnourished. If the inflammation happens in your small intestine, then because of the swelling and because of the fact that your small intestine has a very small lumen, it will cause obstruction. So you will get abdominal pain, you'll get nausea, vomiting. That obstruction can get rupture, then you get fever, you can get septic. So in Crohn's disease, depending on the location, you get different symptoms. And then also in Crohn's disease, the inflammation involves all layers of your small or large intestine. So we call it in medical term transmural inflammation. So the inflammation involves different layers. So what happens when you get different layers involved, and when this process of inflammation continues, that inflammation can then turn into a scar. And then that scar, because it's involving all layers, can cause narrowing, or it can cause fistula. So this happens in Crohn's disease.